Hello again, everyone, and welcome to Women's Health Issues, a channel that focuses on health issues affecting women and how it can be solved, or treatment methods, prevention methods, etc. Today, we are going to be talking about BV. And BV is short for Bacterial Vaginosis, as you can see on the screen right there. So what is bacterial vaginosis? Bacterial vaginosis, or BV, is a condition caused by changes in the amount of certain types of bacteria in your vagina. BV can develop when your vagina has more harmful bacteria than good bacteria. So, who gets BV? Who are susceptible to getting BV? BV is the most common vaginal condition in women ages 15 to 45. But women of any age can get it, even if they have never had sex before. You may be more at risk for getting bacterial vaginosis, or BV, if you 1. Have a new sex partner, have multiple sex partners, if you douche, if you do not use condoms or dental dams, or if you are pregnant. BV is common during pregnancy. About 1 in 4 pregnant women can get BV. The risk for getting BV is higher for pregnant women because of the hormonal changes in their bodies that happen during pregnancy. You may also be more at risk for getting BV if you are an African American woman. BV is twice as common in black women as in white women. Or last but not least, if you have an intrauterine device, commonly known as IUD, especially if you also have irregular bleeding. So how do you get BV? How do women get BV? Researchers are still studying how exactly women get BV. You can get BV even without having sex, but BV is more common in women who are sexually active. Having a new sex partner or multiple sex partners, as well as if you douche, can upset the balance of good and harmful bacteria in your vagina. Therefore, this raises your risk of getting BV. So, what are the symptoms of bacterial vaginosis, BV? Many women have no symptoms, but if you do have symptoms, they may include, but not limited to, an unusual vaginal discharge. This discharge can be white, milky, or gray. It may also be foamy or watery. Some women report getting a strong fish-like odor, especially after having sex. Symptoms may also include burning when urinating, itching around the outside of the vagina, and vaginal irritation. These symptoms may also be similar to vaginal yeast infections and other health problems. Therefore, only your doctor or a qualified health professional can tell you for sure if you have contracted BV. So, what is the difference between BV and a vaginal yeast infection? BV and vaginal yeast infections are both common causes of vaginal discharge. They have similar symptoms, so it can be hard to know if you have a simple yeast infection or you have BV. Therefore, only your doctor or a qualified health professional can tell you for sure. With BV, your discharge may be white or gray, but it may also have a fishy smell. A discharge from a yeast infection, however, may also be white or gray and may also look like cottage cheese. How is bacterial vaginosis diagnosed? There are tests to find out if you have BV. Your doctor takes a simple sample of your vaginal discharge. They may then look at it under a microscope, use an in-office test, or send it to a lab to check for harmful bacteria. Your doctor may also see signs of BV during an exam. Before you see a doctor or a nurse for such a test, don't douche or use vaginal deodorant sprays. They might cover odors that might help your doctor diagnose BV. They can also irritate your vagina. Make an appointment for a day when you do not have your period, which should be obviously. How is bacterial vaginosis treated? It is normally treated with antibiotics prescribed by your doctor. If you get BV, your male sex partner won't need to be treated. But if you're a female and have a female sex partner, she might also have BV. If your current partner is female, she needs to see her doctor also. She may also need to be treated. It is also possible to get BV again. BV and vaginal yeast infections are treated differently. BV is treated with antibiotics prescribed by your doctor. Yeast infections can be treated with over-the-counter medicines. But you cannot treat BV with over-the-counter medicines like yeast infection medicine. What can happen if BV is not treated? What can happen if you do not treat your bacterial vaginosis? If it goes untreated, possible problems may arise. You may develop a higher risk of getting STIs, including HIV. Having BV can raise your risk of getting HIV, genital herpes, chlamydia, PIDs, which means pelvic inflammatory disease, and gonorrhea. Women with HIV who get BV are also more likely to pass HIV to their male sex partners. Pregnancy problems. BV can lead to premature birth or a low birth weight baby, which is determined as a baby that is less than 5.5 pounds at birth. All pregnant women with symptoms of BV should be tested and treated if they have it. So what should you do if you have BV? Or if you think you have it? First of all, see a doctor or a nurse. Take all of your medication. Tell your sex partner if she's a female. But if your partner is a male, he doesn't have to know. Avoid sexual contact until you are finished with your treatment. See your doctor or nurse again if you have symptoms that won't go away within a few days after your antibiotic is finished. Is it safe to treat pregnant women who have BV? Yep. The medication used to treat BV is safe for pregnant women. All pregnant women with symptoms of BV should be tested and treated if they have it. If you have BV, you can be treated safely at any stage of your pregnancy. You will get the very same antibiotic given to women who are not pregnant. So they are basically saying that if you are pregnant, you'll get the same medication that women who are not pregnant will get, and you can be treated at any stage of your pregnancy, whether during your first trimester, second trimester, or your third trimester. So how can you lower your risk of getting BV? Keeping your vaginal bacteria balanced. Use warm water only to clean the outside of your vagina. You do not need to use soap. Even a mild soap can cause irritation to your vagina. Always wipe front to back from your vagina to your anus. Keep the area cool by wearing cotton or cotton-lined underpants. Do not douche. Douching upsets the balance of good and harmful bacteria in your vagina. This may raise your risk of getting BV. It may also make it easier to get BV again after you have been treated. Doctors highly recommend against douching. Not having sex. Researchers are still studying how women get BV. You can get BV even without having sex, but BV is more common in women who have sex. You can also lower your risk of BV by limiting the number of sex partners that you have. So how can you protect yourself if you are in a female relationship? If your partner is female and has BV, you might be able to lower your risk by using protection during quote-unquote sex. Use a dental dam every time you have sex. A dental dam is a thin piece of latex that is placed over the vagina during oral sex. Cover your sex toys with condoms before usage. Remove the condom and replace it with a new one before sharing the toy with your partner. So that advice goes for females in a female relationship. So that ends this session of our health issues affecting women. If you like our content, leave a like on this video, leave a comment if you want. Please subscribe to our channel. The subscription link is in the description below. We also have links to products that if you're interested you can buy them. They're also linked in the description below. So until the next time, this is WHI, Women's Health Issues. Bye y'all.